Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. We are coming to the end of 2024, an eventful year in the world of public health and at IDPH. One interesting thing that happened this year for IDPH was the launch of this new podcast back during our 30 Days of Public Health Observance in April. Our guest on the very first edition was the director of IDPH, Dr. Sameer Vohra, and now we've come full circle at the end of the year, welcoming Director Vohra back to This is Public Health for a look back at 2024. Director, thanks for taking the time. We appreciate it.
Jim, always my pleasure, and it's been great to see this podcast go live and all the incredible guests and meaningful public health information we've shared to our residents in 2024.
We've certainly had a lot to talk about. Let's go back to the beginning of the year, actually at the end of 2023, when IDPH issued a new 5-year plan for public health, the State Health Improvement Plan, or SHIP. Now, why is that document so important, and how is it shaping priorities now and going forward?
Well, the Illinois Department of Public Health, per legislation, works on a state health improvement plan with our partner agencies. And we were very excited in late 2023, but to fully launch it right at the start of 2024 was our Healthy Illinois 2028 5-year plan to help improve the health of Illinois. Now, this plan had some challenges, especially because there needed to be an interim plan during the height of the COVID-19 pandemic. And what this was sort of a really exciting launch of how we saw the future of public health moving and where we wanted to concentrate as a state. What the public saw was 5 important priority areas, those being chronic disease, emerging illnesses, maternal and infant health, mental health and substance use disorder, and for the first time, our 5th priority, to call out racism as a public health crisis. But the State Health Improvement Plan was also unique because for the first time, we decided to focus on core infrastructure issues, issues that we knew had to be built up, foundational issues that when we improve those, we would improve all 5 priority areas and more. Those things like built environment, racial equity, workforce, data linkages, and more. So it's a really exciting effort for us to have introduced the plan in 2024, the work that happened in 2024, as we move into figuring out and creating more pathways to a healthy Illinois 2028.
And various pieces of that plan are being put into motion. One of the things that happened over this year was the Public Health Workforce Transformation Initiative being launched back in the spring. What does that entail, and where are we in that process?
Knowing and understanding how deep our public health workforce challenges are, both here in the state of Illinois and across the country post COVID-19 pandemic, was something that we knew at the Illinois Department of Public Health that we needed to figure out how to partner and improve on with our local health department leaders. Now, in 2022, we were privileged to get a public health infrastructure grant from the Centers for Disease Control and Prevention. That grant allowed us to focus, one of the big focus areas was on workforce development. And so this past year, we did, for the first time in nearly 40 years, bring together partnership with local health departments and IDPH to help think through what would be the best pathways, the best strategies in which we could build up the workforce. That meant that we had to ensure that we knew some of the challenging areas in which workforce was deeply limited. And it meant that we had to think differently about pathways and partnerships. We are a big, diverse state from having the Chicago Public Health and the Cook County Health, where the Department of Public Health sits in it, to 95 other local health departments. And to build that coordinated workforce initiative required conversation and partnership, and we were really excited to launch that in April. We've worked with our local health department leaders. I was able to meet with all of them and to discuss the progress, how we felt like we were moving, some changes that we needed to make, and was able to present this workforce initiative at the Illinois Public Health Association meeting in November as well.
Obviously, that workforce needs the tools to carry out the task they've been given. And one of the tools you have focused on a lot in this year is data modernization. We devoted a whole episode to that earlier this year, but talk again about what it is, why it's so important, and what it will mean for public health going forward.
Well, Jim, part of what we saw during the height of the COVID-19 pandemic was that challenge around how we could get timely data that we could act on immediately. We saw how important that was during the pandemic. And along with our workforce, getting our data systems accurate and right were critically important. That's why through the governor's leadership, in our budgets, we have invested funding to modernize our Illinois disease surveillance system. We've also put in money to modernize our long-term care system. And we're looking at all of our systems to see how we can appropriately update them so that they work together and they work importantly to affect our residents. We also saw this year the continued growth of our informatics section. And in that podcast, we were very fortunate to have Dayan Jovanoff, our informatics chief, talk about some of the really intriguing aspects of this work. Uh, the way that Dayan described the work as often a superhero collecting information and then being able to allow other leaders to provide immediate decision making. And what we need to do there, right, is we need those systems to talk together so that we have a holistic story about what's going on in our communities and what's going on with our residents. One of the things that we continue to grow and magnify is our master patient index. And that master patient index, what it does is allow those different systems to talk to each other. So if we're talking about pregnancy adverse events, if we're talking about asthma rates, if we're talking about respiratory illnesses, how do they link together so that we are seeing the whole story of a community or an individual and not the story just of their disease? And that's one of the exciting elements that this data modernization movement is pushing us to do is no longer to think about public health by a degree or a list of diseases. The public health is not diabetes or Alzheimer's disease or asthma, but instead public health is the health of a community and the health of the individuals in that community. And so we're moving forward there and we're finding new and exciting partnerships. The other person on that podcast was Abel Coe. Abel Coe, who is a professor of medicine at Northwestern University. He heads Northwestern's Artificial Intelligence Center, among other leadership positions. And Dr. Coe sits on our state board of health, and we're partnering with universities like Northwestern, like the University of Illinois, to be on the forefront and get some of the most talented, capable leaders and innovators to help partner with the Illinois Department of Public Health to create that data modernization that will really move us forward, especially in the year 2024 when artificial intelligence was on all of our minds.
Another major priority for IDPH and for Governor Pritzker has been health equity, making sure that everyone has access to the health information and services they need, regardless of geography, race, ethnicity, socioeconomic status, or any other factor. That was a major push this year in the governor's budget when he sought and obtained funding for maternal and birth equity. Explain what you hope that funding will accomplish.
One of these other core elements, we mentioned it with the state health improvement plan, but in our work across 2024 was working on improving health equity, addressing health disparities that we see. And often those terms have um, a particular connotation. But what we're really talking about in the Department of Public Health is to identify those individuals that are less healthy than others and figure out why that's the case. What things are involved, whether that's demographics, whether that's age, gender, race, geography that makes certain groups healthier than others or unhealthier than others. And we saw that very starkly in our maternal mortality and the maternal deaths that we see in the state. That if you are a Black pregnant person, you are 3 times more likely to die from a medically related issue than if you are a white pregnant person. You are 2 times more likely to die from any pregnancy related condition um, than a white person as well. And so, one of the governor's key priorities this session, and the way that the governor has been such a leader in addressing health disparities, was on helping close that gap that we identified in our maternal mortality report in 2023. And what this money did was really bring together a number of different state agencies, Department of Commerce and Economic Opportunity, the Department on Human Services, and we were tasked at the Illinois Department of Public Health to work with academic partners, the University of Illinois at Chicago, to help build a blueprint for action. Now, that blueprint will be live and be able to be presented in 2025. But what it really discusses is different ways that we can help address the disparities that we see in Black mothers, Black pregnant persons, and really determine the strategies statewide to help improve our efforts. Now, we've already done some of that work already. We are one of the unique states, actually the first state in the country to um, make sure that Medicaid covered postpartum visits all the way to a year after uh, the birth of a child. We've also worked in many different ways with our partners at HFS to build and grow doulas and other services that could help augment the work to reduce health disparities. But we know that there's more work to do, and we're excited for this blueprint to catalyze even more action in 2025.
You're listening to This is Public Health with the Illinois Department of Public Health, taking a look back at the year 2024. Our guest is the director of IDPH, Dr. Sameer Vohra. Director, you came into this position during the COVID-19 public health emergency, and even though the emergency is over, COVID-19 is still with us, and IDPH is taking the lessons of the pandemic to heart. This year saw the release of a COVID after action report and a playbook for future public health emergencies. How are those materials being used to get ready for the next crisis that may come along?
Well, what has really come through after the COVID-19 pandemic, and it was a big part of public health beforehand, but even more augmented now, is that an important part of our agency's work is the everyday challenge of preparing for future emergencies. And we were thrilled that our COVID after action report was released in May of this year, that really talked about some of the incredible things that we were fortunate to have the great leadership during the height of the pandemic. But it also spoke to some of the challenges that we're talking in this podcast: the lack of workforce, the challenges around data modernization, our ability to think holistically about health and not just focus on one particular disease entity. And we've been fortunate to have an incredible leader like Governor Pritzker who believes in public health, and we work to put our lessons into motion. Now, the report talked about three primary areas in which we needed to focus on. One was improved preparedness. And what you have seen in the agency is partnerships and funding that have been dedicated to those efforts. IDPH now has a medical services division led by our chief medical officer. We have a number of physicians that are working across the state to identify challenges, areas in which we're seeing outbreaks happen. This only augments the work of our Office of Disease Control and our communicable disease section. And it's a real partnership that also happens with other agencies so that we can identify challenges, respond quickly, and ensure that these infectious diseases don't spread further. We've also built up our public health emergency operations center, partnering with our hospitals or local health departments to ensure that we have better regional coordination to address any big challenge. And we saw that work already with partners like the Chicago Public Health Department and other local partners during our measles response in March of this year. And we were able, despite the largest numbers of measles cases in Illinois in nearly 30 years, able to respond really quickly to ensure that that outbreak was completely closed really early into the summer. Number two, modernize our systems. And we spent a lot of time already on this podcast talking about how important that was, especially modernizing our workforce, modernizing our data. And third, we knew that we had to um, invest in communities and build trust. And a lot of that we've been trying in many different ways, from our continued focus on equity, but also the way that we have built and grown new and different partnerships. We have built new communication vehicles that have allowed us to talk to our residents in different ways, and including this podcast. And we've been fortunate and seen through our budget from the governor's investments to have funding initiatives dedicated to communication, dedicated to preparedness and response, and continued efforts dedicated to modernizing our systems, including our data systems that we discussed earlier as well.
You noted earlier one of the areas of emphasis going forward is on emerging health issues. And one health issue that has emerged in recent years as a public health issue has been the topic of firearms violence. What is IDPH doing to address this growing issue and to protect people from the improper use of firearms?
Well, we know how much of a significant issue firearm violence is, and we've been fortunate to have great leadership in our Department of Human Services and the Office of Firearm Violence Prevention. But we've also taken this on, understanding that it is a critical public health issue as well. So, two things that I'll mention. One, we have invested a lot in thinking about safe storage of firearms. We've been able to work and distribute gun locks across the state, and it's been one of our really exciting initiatives. And we've seen the uptake of so many gun locks throughout the state, hundreds of thousands being delivered and administered through various different opportunities, and from local fairs to other kinds of initiatives. Number two, we also use this to improve our communication. One of the other elements here that we, in partnership with the Illinois State Police, really wanted to move forward on was the idea of firearm restraining orders. And for those that don't know what firearm restraining orders are, it's when individuals feel like they themselves or their loved ones are at risk from an injury or a very scary event, that they can use this firearm restraining order to ensure that that firearm is taken away so we don't have um, a truly shocking or a gruesome event in a family. And we were thrilled to partner with the Ad Council and Brady, the National Gun Violence Prevention Organization, to create a one of a kind firearm restraining order public health campaign called Pause to Heal. And we worked with the Illinois State Police and others to really put this message out there to say that what a firearm restraining order does is it gives an individual or a family a pause to heal. And we were excited to see that throughout the state and excited to get national attention from the White House and others about how this meaningful partnership could translate to other states across the country.
Director, before we go, as we draw to the end of 2024, a lot of people are thinking about what's ahead in the new year with an upcoming change in administration in Washington and how that may impact the federal approach to public health. How is IDPH preparing for the new federal administration, and what else is in store for the agency and public health in general in 2025?
Well, we do know that a federal administration change um, always means a place for us to reassess what the goals of that federal administration are and how the Illinois Department of Public Health will partner. We know that there may be certain changes, and we are working throughout with our partner sister agencies, community based organizations to ensure that are continuing our commitment to the things that we know matter. Now, the governor has also spoken about the importance that the state of Illinois really takes on to making sure that we preserve reproductive health and reproductive access, that we're preserving our elements to make sure that we ensure that Illinois residents can be their authentic selves, things that we know are critically important as we address health disparities. Now, those things are not going to change here at IDPH, and we're going to continue our efforts to move those initiatives forward. But we'll also work with the federal government and their partners to ensure that we address the many different health issues that are going on here in Illinois and throughout the state. And I'd say for 2025, we will continue our important mission and continue this important pivot to ensure that public health is not about just infectious disease, although it continues to be a core part of our work. We want to ensure that public health is about the health of communities and really working to spread that message and working along our systems to ensure that the money that we distribute helps our communities thrive, that the programs in which we run helps our individuals in those communities blossom, and ultimately make sure that our agency in its communication, in its service, is truly about building brighter futures for all of our residents. I'm so excited for all that we have done in 2024, but even more excited about what's to come in 2025. A real effort here where we're growing our department to help improve the health of all, every single resident in every single corner of our great, big, diverse, and beautiful state.
Director, there's a lot more we could talk about. We are unfortunately out of time. Thank you for joining us for this recap of 2024, and we look forward to sharing more information with our audience in the year ahead on This is Public Health with the Illinois Department of Public Health.